Good afternoon, everyone, and thank you for joining us. Welcome to the Understanding Public Policy session. My name is Amanda Krapitsky, and I am the Policy Director at the Autoimmune Association. Today's session features two messages from distinguished members of Congress discussing the important work they are doing in Congress to better the lives of autoimmune patients, followed by a discussion between Sloan Salzberg and myself, where we will discuss what's going on in Congress, bills we are following in the autoimmune space, end of year expectations, and how you can become a more involved advocate. I would like to introduce our first featured message from Congressman Brad Winstrup. Representative Winstrup was elected in 2012 to represent Ohio's 2nd District. He brings experience as a doctor, Army Reserve officer, Iraq War veteran, and small business owner to help Congress tackle the economic and security challenges facing the nation. Rep. Winstrup serves on the House Committee on Ways and Means, where he sits on the Subcommittee on Health. He also serves as chairman of the Select Committee on the Coronavirus Pandemic. Here is a message he wants to share with us today on legislation he is working on to serve autoimmune patients.
Hello, I'm Congressman Brad Winstrup, representing Southern Ohio. Thank you for inviting me to speak with you today at your 3rd annual Autoimmune Community Summit. I'm sorry I could not be there with you all in person, but I'm glad for the opportunity to address you virtually. There are over 100 autoimmune diseases, and it is estimated that 50 million Americans have one or more of these diseases. That's around 1 in 10 people that are affected by diseases like rheumatoid arthritis, lupus, Addison's disease, type 1 diabetes, and multiple sclerosis. I'm grateful for the work you do advocating on behalf of patients with these diseases, many of whom I treated throughout my career. The research and education you offer to people and how you have raised awareness about these diseases at the federal level and state level are extremely important. As a physician and a member of the House Ways and Means Committee who serves on the Health Subcommittee, I'm focused on making sure patients are at the center of healthcare policy, especially when it comes to Medicare. I'm also co-chair of the GOP Doctors Caucus, a group of 20 physicians in the House that came to Congress after a career in medicine. I find that this real-world experience is invaluable to policymaking. Too often, health insurers' prescription restrictions, protocols, otherwise known as step therapy, cause patients unnecessary delays in care, forcing them to try and fail on ineffective medications before allowing patients access to what their doctor originally prescribed and what they felt was best for them. My bipartisan bill, the Safe Step Act, which I reintroduced with Congressman Dr. Raul Ruiz, would provide guardrails to make sure insurance companies follow a clear and expedited process that allows patients to access their needed and appropriate medications quickly. This bill would prevent insurers and PBMs from making harmful substitutions for prescriptions and minimize the potentially harmful delays caused when insurers make you jump through so many hoops. I'm encouraged by the positive movement we have seen on this bill lately. The House Ways and Means Committee recently approved legislation that brings more transparency and clarity to the cost of health care. This package included an important provision that would increase oversight of the pharmacy benefit managers, PBMs, that are negotiating prescription drug prices. I want to make sure that the rules put in place benefit patients and pass along savings in addition to a lowering drug cost. As I approach policymaking, I want us in Congress to not solely be looking at extended lifespans. I want us to extend the health spans of all Americans. How do we keep Americans healthier longer? How can we make America the healthiest nation on the planet? The legislation I am leading in Congress is working to get at these answers, from healthcare access to incentivizing healthier lifestyles. I've introduced H.R. 485, the Protecting Healthcare for All Patients Act, a bill that would expand access to life-saving cures and prevent discrimination against Americans with disabilities by preventing the use of quality-adjusted life years, something called QALYs. In all federal programs, we want to eliminate this. The quality-adjusted life years measurement puts people with chronic illnesses and disabilities at the back of the line for treatment. This is morally wrong. I'm also working on a bipartisan bill called called the Ensuring Patient Access to Critical Breakthrough Products Act of 2023. Legislation that would provide Medicare patients faster access to FDA-approved breakthrough medical devices. This bill removes unnecessary barriers that prevent seniors from accessing the most innovative and cutting-edge treatments. Patients should not have to wait years for a Medicare coverage decision on life-saving treatments. With this legislation, millions of seniors could live longer, healthier lives. I was pleased to see this pass out of the House Energy and Commerce Committee, and I look forward to the opportunity to vote in favor of it when it comes to the House floor. I'm grateful for your work in helping to improve the health and well-being of Americans with autoimmune diseases. And I'm eager to continue to work with you on important healthcare legislation as we work to make America the healthiest nation on the planet. Thank you for allowing me to join you virtually today and continue the good work. God bless you and God bless America.
Now I would like to introduce our second featured message from Congresswoman Mariannette Miller-Meeks. Representative Miller-Meeks was elected to Congress in 2020 to represent Iowa's 1st District. Like Representative Winstrup, she has also joined the Army, where she served for 24 years as a private, nurse, and then ophthalmologist before returning to life as a private citizen. She is a member of the House Committee on Energy and Commerce, where she sits on the Subcommittee on Health, as well as the House Committee on Veterans Affairs, where she serves as the chairwoman of the Subcommittee on Health.
Hello, I'm Mariannette Miller-Meeks, and I represent Iowa's 1st Congressional District. The 3rd Annual Autoimmune Community Summit is an educational and empowering summit led by autoimmune experts, researchers, physicians, policy experts, and patient advocates. Thank you all for inviting me to join your important discussion about health policy. Your work to discern the most pressing topics impacting the autoimmune community is inspirational, and the fact that you all are able to leave this summit with a stronger, supportive, and collaborative community is nothing short of amazing. As a doctor, I believe that our patients deserve the best treatment and care available. I am also a member of the GOP Doctors Caucus, where we regularly meet to discuss and develop patient-centered healthcare policy here in the U.S. House of Representatives. I was proud to introduce the Share the Savings with Seniors Act, legislation that ensures senior patients with chronic medical conditions are able to directly benefit from the savings that their plans and pharmacy benefit managers negotiate on their behalf. Pharmacy benefit managers are PBMs. This legislation lowers out-of-pocket costs for our seniors with chronic medical conditions. In today's economy, where we are battling debilitating inflation rates and skyrocketing prescription prices, our seniors are often looking for financial relief without sacrificing the quality of their medications. I also introduced the Help Ensure Lower Patient Help Copays Act, legislation that protects patients from harmful PBM practices that raise patient out-of-pocket drug costs by not applying drug discount coupons toward a patient's deductible. I also partnered with Senator Chuck Grassley on the Accelerating Kids Access to Care Act, which improves access to life-saving care for children with complex medical conditions by shortening delays to care for children who need to travel out of state to receive treatments. The Accelerating Kids to Access to Care Act simplifies out-of-state Medicaid screening and enrollment processes for pediatric care providers while retaining key safeguards to preserve the integrity of the program. Finally, I joined my colleagues and introduced the Safe Step Act, which would improve step therapy protocols and ensure patients are able to safely and efficiently access the best treatment for them. Your participation in the Autoimmune Community Summit increases awareness and advocacy, and I am grateful for your involvement. I hope that you all enjoy the summit, build strong support systems, and discover ways that you can not only live with your autoimmune disease, but can also thrive.
Now, before we do a deeper dive into some of the policies mentioned by Rep. Winstrup and Miller-Meeks, I would like to introduce Sloan Salzberg, Vice President of Horizon Government Affairs and board member of the Autoimmune Association. Sloan specializes in health policies related to general health reform and prescription drugs, including medication adherence, precision medicine, and value-based payments, as well as third-party alliance building and coalition management. Prior to joining Horizon Government Affairs, Sloan worked as a health policy fellow for U.S. Congressman Phil Gingrey. She graduated from Georgetown University with a Master's of Science in Biomedical Science Policy and Advocacy. Prior to Georgetown, Sloan attended the University of Florida, where she graduated with a Bachelor's of Science in Zoology and completed a senior research thesis on American alligators. Sloan has been an adjunct professor in biology at Daytona State College and has worked as an emergency room technician. She was also formerly my boss when I was at Horizon Government Affairs. So thanks so much for joining us, Sloan, today. So as those video messages you could see were pre-recorded, both members wish they could have joined us live today. As you can tell, this means a lot to them. But unfortunately, with the threat of a shutdown last week and with the current speaker position being open and votes could be, at any minute if they so decide, we thought best they could join pre-recorded so their calendar schedules wouldn't be up in the air. Speaking of what's going on in Congress, Sloan, do you want to tell us about the things that are going on in the past couple of weeks?
Sure. Thanks, Amanda. And hi, everyone. Thanks so much for having me. As Amanda said, I kind of wear two different hats here. So I'm a health policy kind of consultant in Washington, D.C., but then also I sit on the board of Autoimmune Association and, have personal ties into the autoimmune space. So very happy to be here and excited for this summit, and especially because it's our third annual one. So thank you. So first off, if folks have not heard, we don't currently have a Speaker of the House. I think I was joking earlier with some friends. We're in unprecedented times again. And I think we are all tired of being in unprecedented times. So Speaker McCarthy was ousted as Speaker last week by a small cohort of Republicans in the House of Representatives. And this is kind of a historical moment. The reason why they kind of voted for his ouster was because McCarthy and some Republicans joined with Democrats in order to fund the government or to keep the government funded at current rates. And that's until November 17th. And so right now we have until November 17th to figure out again, how do we fund the government? But pause that. We first need to have a Speaker of the House because you cannot do business in the House or Congress without an acting Speaker. And so things are kind of up in the air right now. It might take 1 week, it might take 2 weeks, it might take more. If folks remember when McCarthy was actually getting voted in as Speaker, it took a unprecedented 15 times. So we're at this kind of just, it's just a new day. We're taking it one day at a time. There are two members right now that have kind of thrown their hat in the ring from the Republican Party. Representative Jim Jordan, who's from Ohio, and then Majority Whip Steve Scalise from Louisiana. There are a couple other members that are, I think, kind of towing the lines. And I believe there is supposed to be on Monday evening a kind of roundtable event discussion where all of the candidates are going to kind of talk about why they deserve to be Speaker of the House. And so Amanda doesn't know. I don't know. If people on the news are telling you that they know, I think that they are fibbing. Nobody knows what's going to happen. And until we kind of figure this out, regular order with Congress, unfortunately, is kind of put on a little bit of a pause. So things are up in the air. I don't know, Amanda, did I miss anything there with the current?
No, I think it's just, a week ago, we thought the government would be shut down today. So anyone who is anticipating what's happening in the future couldn't anticipate this. So I think we're all kind of shocked in DC. I think there are some things to note with the current. McCarthy was the biggest fundraiser for the Republican Party. So that's kind of how he came to power. He was bringing in the most money. Steve Scalise is the second highest fundraiser. So that's why people, I think, are leaning towards thinking he might take the position, but you never know. I mean, your guess is as good as ours at this point. So like we saw on the two videos, there's a whole lot of policies going on in this space, and none of those can move forward until we have a speaker, but we still kind of want to bring them to your attention, just so you know what's happening and what can affect you as an autoimmune patient. I think the top thing that is on everyone's minds when you come to an event like this is PBM reforms. So PBMs are pharmacy benefit managers. They kind of play an intermediate role between pharmaceutical companies and insurance companies, and they do a lot of negotiations on the cost of drugs and what they pay insurance companies versus what they buy the prescriptions for. So they have been, in recent years, kind of finding different loopholes and using different tactics to control what patients are using, which drugs, based on formulary tiers and how they're charging different insurance companies. So the government has tried to step in to kind of rein some of that back. So they're kind of focusing on increasing transparency within PBM business practices, limiting the fees they can charge, because right now it's a percentage. They're looking to make that a flat fee to kind of make it more fair without perverse incentives. They're looking to pass through savings that the PBMs are negotiating to patients, which I think is a huge priority for us at the Autoimmune Association. We want you guys as patients to see savings when you go to the pharmacy counter. And then spread pricing, which is when PBMs charge insurance companies more than the cost of a drug than it's acquired for by the pharmacy. So lots going on in that space.
And I'll just add, so when I go back home and kind of, I'm actually in Florida right now visiting my family, and describe the complicated environment that is drug pricing, or that how patients get drugs. So you've got the kind of manufacturer, right, of the drug at the top. And then you've got the patient, who gets the drug at the end. And there are about 10 different entities that touch that drug, or, have some kind of role in between making the drug and the patient getting the drug. And so if you think about that spread, each one of those entities is taking a little piece of the pie out. And PBMs right now are really on the chopping block in Congress. And I think a lot of patients, some folks might hear them and think they're the middlemen, because they don't usually directly interface with patients. Sometimes they do for some activities, like if you ever have medication therapy management and you get a phone call from someone saying that we want to walk you through all of the different drugs that you are on, that sometimes can be a PBM or an avenue of your insurance company. And so these PBMs right now, if you guys remember last year, kind of manufacturers were put on the chopping block for the first time ever. Now Medicare can negotiate drug prices. Now PBMs are kind of getting their turn. And as Amanda said, there's a ton of different bills right now in both the House and the Senate that have kind of moved forward, and how it all shakes down and what that final piece is going to look like is still kind of questioned. We've got lots of questions around that. And we're also at a point, I think, in our in Congress and legislation where most bills, you heard both members of Congress talk about these bills. Most bills do not actually end up passing on their own. If you guys ever remember, if folks are around my age and you started watching Schoolhouse Rocks, where I'm just a bill sitting here on Capitol Hill.
So good.
I know, I'm going to start singing the song. So a member of Congress introduces a bill, right? And then that bill will go to committee. So I think Congressman Wenstrup and Marionette Miller Meeks both talked about the Energy and Commerce Committee and the Ways and Means Committee. Those two committees are the main healthcare committees of jurisdiction in the House of Representatives. So they're the ones that actually go through the bills and they mark them up and they kind of try and make them better. And then they're voted out. And then ultimately the bill will go to the full House floor for a vote. And that is why you need a Speaker of the House, because he's or she are the one that determines kind of what comes to the floor for a full House vote. Then if it passes the House, then it goes to the Senate, and it's kind of a very similar process over there. And then if the two bills are the same, they are then passed to the president, and the president signs them, and it becomes a law. it's really, really complicated. And with this PBM stuff in particular, there's so many different pieces of legislation and language that they all need to be harmonized, and it needs to be one ultimate bill. And so what that looks like is TBD, but it is really important. And I know we'll get to it at the end, for patients to weigh in and to talk about what are the things that affect you, and make sure that your member of Congress knows that, because what Amanda talked about, there's pieces of that like increased transparency. That means that we're trying to have oversight into what these PBMs are actually charging different people, because what are they pocketing versus what are they making versus what are they charging patients? So all of that's a little murky right now. And then Amanda talked about pass-through savings or spread pricing. These are another kind of way on how the PBM makes its money, and what is the value that they are providing to patients and to insurers. And so we want to provide a little bit more, I think, or Congress right now is trying to figure out, how do we make sure that PBMs, they do offer service, they help to negotiate all of these really awesome networks, but are they paid adequately for that service, and do patients actually see those savings and benefit from that? And sometimes they do, and they get lower premiums, right? Those monthly premiums that patients share, PBMs help to keep those down, but then sometimes individual costs for specific drugs, those go up. And so trying to figure out all of that math, as you can assume, is really complicated. But the Autoimmune Association, I know Amanda in particular, is keeping a really close eye on what's going on. And we will continue to make sure that you guys, as our patients, constituents, know and can weigh in with your members of Congress.
Yeah, absolutely. And that's like Marionette Miller Meeks. She introduced the bill, the Share Savings with Seniors Act, which would directly require those patient cost sharing to be passed through in Medicare for individuals with chronic conditions like Sona's talking about. So these are real policies out there we're keeping an eye on, and we'll let you know how to get involved in just this short act. So I know in addition to that, there's the Health Copays Act. So we haven't talked as much about that, but this bill will require health insurance plans to help copay assistance to individuals with cost-sharing obligations, so deductibles and out-of-pocket maximums for their insurance companies. And then copay accumulator programs, which don't count to assistance towards deductibles or out-of-pocket maximums, would be banned for health insurance plans regulated at the federal level. And those are usually offered by large employers. So we actually had a court case just a few days ago where the DC District Court struck down the rule that allowed insurers and PBMs to pocket copay assistance intended for patients. So we're really supportive of this method. It saves your costs directly at the pharmacy counter, like I mentioned before. And we recently signed on to a letter to ask CMS not to appeal this decision. So I think this is, we're working with a lot of other patient groups in this space. There's a lot of coalition building here in DC where we work together to expand our voice and amplify the messages of all the patients we represent, which I think is huge as well.
And that is really important for patients. And if you guys know, sometimes you get those coupons from your doctor's office to say, oh, this drug might be $400, but for you, it's only going to be $10. And so those are the kind of coupons or copay assistance that Amanda's talking about there. The next bill that we wanted to highlight for folks is called the Safe Step Act. And I think both members kind of referenced this bill. So it is introduced by Congresswoman Lucy McBath, who's from Georgia. And she's with Representative Wenstrup, who we heard from, Ruiz, who's actually another physician from California, Marionette Miller Meeks, who we heard from Iowa, Chavez DeRemer from Oregon, and Blumenauer from Oregon. And this Safe Step Act has to do with, I'm sure actually most people in the autoimmune community are very familiar with step therapy, which insurance companies put this in place to make sure that you get very honestly, you get the cheapest drug that works for you, is what the whole point of this is. Unfortunately, as we know in the autoimmune space in particular, different drugs have different effects for different patients. And oftentimes you find a drug that works great for your condition, and then you switch insurance companies and, oh no, you have to start over again. And you're like, no, we know which drug works. We need to, call. And it's a big, arduous process to get that kind of waived. And so the Safe Step Act helps to make that process a little bit easier. It's another way, sometimes they call it fail first. You need to step through or fail on a therapy before you go to another one. And so, as we know, spending time and money on a lot of alternative treatments that do not work can be very dangerous for patients, can lead to further delays in treatment and additional costs for our healthcare system. So this is a really good bipartisan bill that creates these guardrails to make sure that the physician, the prescriber, has a little more autonomy and making decisions with the patient to make sure that you get the right drug for you. So we're hoping that that bill breaks loose and goes through whatever happens at the end of the year. And I'll add this, I kind of mentioned it a little bit before. So right now in Congress, bills don't usually pass by themselves. Mm-hmm. Like normally, right, you get a bill, you've got tons of bipartisan support. We're going to talk about it down there, things that you can do as a patient or constituent. You can call up your member of Congress and ask them to do various things. Unfortunately, we're at that time where most stuff goes in we call them packages, because DC, we have our own lingo for everything. And so legislative packages. So usually it's the big funding stuff that happens at the end of the year, and they'll tack in a whole bunch of bipartisan stuff. And so that's how things get passed these days. What we don't know is for this end of the year, we don't know who our speaker is. We don't know how we're going to fund the government. There could be another shutdown come November. And then next year is an election year. So there's a lot of question marks, but if we end up getting our speaker, if we fund the government in November, we think there could be an end of year big spending bill. Sometimes they call it like a Christmas tree bus because it's the end of the year, but it's an omnibus. And that will be the vehicle that some of these bills that we talked about could get tacked onto and passed. All right. Oh, now that, and I kind of alluded to this, so now that we kind of went through a few of these bills and what's going on in Congress, let's discuss some ways that those attending this session can get more involved.
So if you look to a link that should be getting dropped in the chat by one of my colleagues, we're actually starting a campaign. So I know getting into the weeds of some of these policies may be a bit daunting, but we've try to create a super easy way for you guys to get involved. So we've set up this campaign where you can reach out to your member of Congress and to senators and ask them to support the Safe Step Act. Currently, the bill has 126 co-sponsors, 78 Democrats, 48 Republicans. And by asking your member to support this bill, it raises their awareness of the issue. And it's important to their constituents and to autoimmune patients. So we've drafted the letter for you. So if you want, you can just go in and hit send, and it'll get populated to your members based upon the address and zip code you put in. But if you want, and we highly encourage, you also have an ability to share your own story at the top or end of that message. So that way they can hear from you and hear about your personal experiences as well. If your member has actually already signed on to the bill, the system will know that by you putting in your zip code. So it instead will send them a thank you letter, thanking them for making this one of their priorities.
And then the most important thing that I think Amanda and I can leave you with is that anybody can become an advocate. And so honestly, it's just a conversation with your member of Congress, whether or not it's your representative or your state senator. It's calling up, it's emailing. If you're in Washington, D.C., it's letting Amanda know, and maybe you can do a co-Hill meeting together and she can kind of teach you how to do a Hill meeting. But it's really just a conversation between you and the staffer or you and the member of Congress to tell them, what are the things that you care about, the things that impact your life, and how can that member help you out? And I know there are several opportunities on the Autoimmune Association's website for individuals to share their stories. So if you mention that, Colleen will drop links in the chat. And then honestly, the most important thing is just vote next year. Yeah. That's so important. Amanda and I know we're huge advocates, is vote, is look into who's running in your race and what they care about, and reaching out to the candidates and telling them, like, I am an autoimmune patient and these are the things that affect me. And then just talking and sharing your experience, because as a former staffer, that was important to me. If I have my boss is working on a bill that I know a personal story to one of our constituents, makes all of the difference in the world. So vote and become an advocate for yourself, and ask, Amanda or anyone at the Autoimmune Association. You can reach out to me. We're here to help, and we can help you guys navigate Congress. But these guys were elected because of you, and they are there working for you.
Absolutely. And so when you fill out that campaign, if you want to become even more involved and do those meetings like Sloan mentioned, my email is on that list, and you can just shoot me an email directly, and we can work one-on-one or in a group setting to help develop advocates for autoimmune patients. But I see we're at the end of our time, and I want to thank everyone for joining in, thank everyone in advance for sending this letter to their representatives, and have a great rest of your summit.
Awesome. Thank you all.